Hey guys, back again. Well, it's been 4 days since I had my operation on my right shoulder, and I can say that it's completely different story from my last videos and when I first came out. Basically, everything's gone according to plan. I can't remember what I said in my last videos because I was quite out of it. And the reason for that, I've sort of attributed to a particular drug that they were giving me post-op. It's called Temgesic, Temgesic, I think it is, Temgesic in Australia. Basically, it's a new drug that's come out that's supposed to be as good as taking things like oxynorm, oxycodone, things like that, but it's not supposed to give you that addictiveness. So it's got supposed to have less side effects and less of an addictive nature. But it's actually made me very sick to the point of I'm pretty sure that's what made me pass out before I was discharged out of the hospital, because I took it again the second day I was home and I was absolutely nauseous, worse than it was when I first came out of the general anaesthetic in recovery. And I was actually not wanting to wake up. My breathing rate slowed down dramatically to the point where my skin started turning green, that green-grey colour. And I felt like death. Not even death warmed up, just felt like death. So straight away I said to my family, I don't want to take that anymore. I'm just going to stick to tramadol. And that's basically what I've been doing. I've been taking my tramadol tablets along with Celebrex, which is an anti-inflammatory, and my paracetamol tablets for pain relief. And that's all I've been taking. Now we're on day 4 and I feel great. I've started my home physio, sort of trying to build that up a bit more. I'm actually able to have my arm out of the sling, sort of dangling by my side for a while. I'm able to lift it to the recommended 20 degrees in front of my body, sort of 20 to 40 degrees to the front of the body, no more than 20 degrees to the side, abduction. And I'm actually quite impressed with how long I'm able to leave it out of the sling for now. I do it sort of 10-15 minutes at a time. Usually once I've woken up, I'll put my ice pack on for 20 minutes and then I will stretch it out before I put my sling back on. I'm not able to eat too much at the moment without feeling too sick. So I'm having lots of smaller meals and lots of little snacks, keeping up my water as well, just to try and keep me well hydrated and sort of keep me feeling relatively normal. I usually drink about 2 to 3 litres of water a day, so I'm trying to keep that going. Basically, everything seems to be going on track. I've got my first physio appointment next Wednesday, so no doubt he'll give me a whole new range of movements to do with that, and it's going to be quite painful. So looking forward to getting my arm moving again, but at the same time not looking forward to it because it is still, under normal circumstances, quite stiff. So we'll see how that goes. I've got my post-op appointment, I think it's next Thursday, no, not next Thursday, the week after, so another 2 weeks with the surgeon, so hoping everything goes good with that. Not sure if I mentioned on my last videos, I've actually got dissolvable stitches on all, I think there's 4 or 5 incision points there. I can't actually see because they're still all covered up. I'll see if I can show you guys. I've still got them all sort of covered up there. But all those dressings are looking nice and dry and everything, so I'm able to shower. I just had my husband give me a hand just scrubbing my back, but other than that I'm able to do everything else, which is good. Still brush my teeth, do my hair, and actually got myself dressed tonight. I've got a long sleeve pajama top on and able to get my sling and everything on, so slowly but surely everything's coming together. Just a few points before I go, we'll say hiring the automatic recliner was the best thing I ever did. I'm someone who suffers from mild insomnia, so I can't sleep at the best of times. Even though I'm on pain medication, yes, it can make it a little bit easier. I'm actually falling asleep and staying asleep, and I'm not waking up with a sore back, not a sore shoulder, sore neck, nothing. I'll just see if I can swing back to show you guys. There it is there. I've got a nice electric recliner there. Mind all the mess, I've just basically dumped everything on my bed. I'll worry about all that later. So yeah, basically everything's going good as far as my recovery goes. making sure I keep moving it, making sure I'm eating healthy, I'm getting lots of sleep. Basically all I'm doing when I'm not awake and sort of moving my arm around or icing it is sleeping. I've set myself sort of a 2-week goal. So the first week I'm just resting at home after the operation. So that's coming up to sort of next Tuesday. And then the week after that I want to start getting out and about, just going shopping, food shopping, like getting my mum to obviously push the trolley and drive for me, but getting out and about, being able to drop the kids at school again, and just basically doing sort of all my normal routine things again. Maybe start sort of, you know, light vacuuming around the house with my little portable vacuum and things like that with one hand. I'm able to make myself a cup of tea, get myself some snacks and stuff out of the fridge. So yeah, basically I'm not the cripple that I thought I would be, which is awesome, but still it's quite hard being quite restricted in that sling when I'm used to doing pretty much everything for myself when I want to and how I want to. I hope these videos again are helping you guys. Any questions, leave them in the comment box below. Hopefully by now, if you're seeing this video, it means I've uploaded my other ones from the hospital. Can't guarantee how good they will be because I was quite drugged up post-op, but hopefully, if nothing else, they give you a bit of a laugh. All right, guys, I'll try to do another video in a couple of days and let you guys know how I'm going. See ya.